Hey, what's going on, everyone? I'll just wait like a few seconds for people to jump in. But we'll be kind of changing pace this time around for our Facebook Live. And today we did a lot of like lifestyle stuff for a few weeks and a lot of nutrition stuff for a few weeks. But today we're going to be back in the gym, and we're going to be covering some physical fitness things. Okay, so I hope things are warming up in your guys' area. In my area, it's still pretty cold. I mean, it's kind of started warming up a little bit, but for maybe like a week or two, it was like 10 to 20 degrees in the morning, which made it kind of tough to work out because I most always just wear shorts when I work out anyways. So today we'll be covering like a very important and very common problem. So we'll be talking about like back pain, which is like an umbrella term that could encompass like almost anything, but it's very common and probably like the bulk majority, not probably, definitely like the bulk majority of people have some kind of clinical episode of clinical level of low back pain, at least like once in their life. And a lot of people have it like multiple times in their life. And the most common thing is people have kind of like a grouchy lower back generally throughout their life after their initial injury, et cetera, et cetera. And I have topics here on my sheet. That way I don't remember to cover some important aspects. And we'll just kind of go down the list and cover one thing at a time. That way, if you do experience low back pain, which could kind of hinder your workouts and just make working out like not pleasant in general and something you don't look forward to, and more importantly, probably make your day-to-day existence not pleasant because it kind of affects you pretty much 24/7 to one degree or another, depending on the level of back pain you have. So I'm just going to kind of go down a list of steps one can take if they've had an injury, just to get like a proper diagnosis and proper treatment and not waste a lot of their time running around, especially with symptom management practices, and wondering why their low back pain is not getting better. So yeah, I mean, just like I covered, especially injury to the L5 disc, it's probably the most common orthopedic injury, period. So you're not alone, definitely, if you've had a back injury. Many people have had back injuries from various different fields and athletic events and job occupations, et cetera, et cetera. So let's start off with topic one. A lot of times you hear people say, I have like back pain, and that's generally like a term that's like extremely vague. It's probably the same. I personally don't know anything about cars, but it's probably the same as saying, oh, my car's not starting. It's like, okay, like, what does that even mean? There could be like a myriad of variables that are leading to the car not starting. Is the starter not working? Is there not enough gas? Is the electricity not working? Or is one of the switches broken or something, or rather of that sort? Once again, I don't know anything about cars, but it's the same exact thing when you hear the phrase, I have even low back pain. So that seems like a lot more specific and kind of gives the general area of where the pain is perceived, but it's still like very vague and doesn't really provide literally any information in terms of what's causing the person's pain. So there could be a myriad of reasons, but for example, is it a posterior lateral disc bulge to the left or the right side of the L5 disc, or maybe L4, or maybe L3, or maybe L2, or maybe L1? Is the pain radiating down the leg? Is it radiating down the back side of the leg, which indicates that it might be an injury to the L5 or L4? Or is it radiating the front of the leg, which might be an injury to the upper portion of the lower back? Is the person compression intolerant, meaning like when they put weight on their back, they kind of feel quite a bit of pain and discomfort there? That could indicate that they might have like an end plate fracture or compression intolerant. Maybe it's kind of in the lower extremities. Maybe they have an SI joint issue, maybe a piriformis issue that's kind of referring pain to that lower back. And most often they have kind of like a combined set of symptoms. So like possibly like an injury to the L5 plus an SI joint issue, or plus a piriformis issue that's contributing to the pain of the lower back. Sometimes it could be even something as random as like a tumor that's growing in that area that's pressing against a nerve. So there might not be any kind of damage to the spine, but because this tumor is kind of growing, it's pressing against the nerve, and it's going to be causing pain and irritation and making it tough for you to work out, and just making it tough for you to kind of live an enjoyable existence day to day, okay? So it's very important to determine like what is actually causing your low back pain and come to a precise diagnosis, because without knowing that, you're basically just kind of relying on, as Stuart Mcgill would say, dumb luck, which works sometimes in the short term. It works sometimes. You maybe guessed of what's going on and you picked the right treatment and it just worked for you, but it's very rare, and from my experience, it never works to create lasting change in terms of lasting resolution of low back pain, because the person was never educated on exactly what is going on with their back, because they don't know, because a precise diagnosis never happened. And thus, they don't know how to change their behavior, which is most often what led to that injury to begin with. Because for the most part, like short of a car accident, when you have a person that's experiencing low back pain, like they've literally just done it to themselves through years, if not decades, of just faulty movement patterns or just working out way too much. Most of the time, just those two combined, faulty movement patterns with working out way too much, that kind of degenerates the joints or cause other damage in the back that could lead to clinical levels of back pain. So that's why it's very important to come to that precise diagnosis and know exactly the pain mechanism that's leading to the pain, so you can A, get that person on a proper treatment plan, and then B, also educate that person on this is what's going on with your back, and this is what you need to be conscious of and what you need to do to not only recover from the back pain, which could take years to oftentimes maybe 10 years to fully recover, but also stay away from that back pain, meaning not only did you recover, but you're able to know exactly what to do to not have that injury happen again, or have like another type of back injury happen, et cetera, okay? So to come to that precise diagnosis, there are a few things, and I'm getting these procedures from Dr. Stuart Mcgill. I took his online course, which is very, very extensive, and read all his books. And the first step is always to do a very, very thorough assessment with the back pain patient. And this usually, from my experience, takes about 30 to 60 minutes, depending on what's going on with their situation. You know, like how long have they had the back pain? Of course, there's probably an episode that caused the back pain, like I was lifting a heavy box at work and my back blew out. You know that for sure, but what led to the myriad of poor movement patterns that led the back to be vulnerable to the point of where that patient picked up that box and finally had an injury? Because a lot of times people, they associate that specific incident with their actual injury history. So they're like, well, I was picking up this box and that's what caused my low back pain. Sure, that episode might have set you over the biological tipping point of that specific damaged tissue, whatever that tissue may be, but there has been literally years or decades of abuse and poor movement patterns that have led to that tissue weakening over time and eventually becoming so weak that the biological tipping point has dropped so low that picking up that box, which required this much stress, surpassed what that tissue can handle, and thus you had an injury or you had some kind of lower back pain episode. But that's just not how it works. Like I said, just short of like a very extreme car accident or something of that sort, or maybe you're in a warehouse and a huge box fell on you and just totally crushed your spine. Most often literally 99% of back injuries just happen because of years of poor movement, years of neglect, years of overuse, and then eventually just kind of, as the saying goes, the straw that broke the camel's back, you know, et cetera, et cetera. So that's why the interview is important, because you get to know, A, what this person perceives in terms of their pain mechanism, B, their life demands. Like, is this person like a high-level football player, or is this person working at a grocery store and having to pick up very light boxes, but many times, you know, hundreds if not thousands of times a week, et cetera, or they're an office worker and they're kind of sitting all day and don't really have that much demand on their body outside of that. And it's important to know this situation because that's what's going to be important to determine what kind of penalties they're imposing on their back throughout the day. So the corporate worker, I would instantly think, well, this person's probably just sitting all day. They're probably very overweight, very stressed out and sleeping poorly, et cetera, and all those things could be actually adding up to their back pain and also keeping them in a state of having pain. Also, I'll be thinking like, well, they're sitting all day, they have compression on their glutes and they might not be able to activate their glutes well, et cetera. They might not even know how to hip hinge, how to have spine sparing movements. And kind of same thing with the grocery store worker. They might have more low-grade dynamic movement, but I'll be thinking, well, this person has possibility of a lot of repetitive movement, which could also lead to back pain as well. If you just excessively do one task over and over again, that could overload specific tissue, and that could lead to an injury also. And then on the higher end, we have like a football player. Obviously, with the professional football players or any professional athlete in general, you have a tremendous amount of biological demand on that body. So you would have to approach that way differently. And without this thorough assessment, not only would we not know exactly, what is demanded of this individual and what possibly led to their injury, but we just don't know how to actually establish a proper therapeutic program, especially when we get into reintegrating that back pain person into their activity level and what kind of demands they need to match. Because you need to know, like, okay, this person needs to be operating here, they're here because of their injury. Now we know that we have to close this gap somehow, and what are the best tools and best ways we can go about with closing that gap? Where the football player is here, but let's say the office worker is here. Okay, their gap is a little bit lower. So maybe we don't need like so much volume or so many exercises, and we can still get to their desired goal, get them out of back pain first, then get them to their desired goal. Let's say they just like playing with their kids on the weekend, for example. They're like, okay, then that is the maximum of their biological demand that their system needs. So we need to establish a therapeutic program that would get them to match that level of demand and not really stress the body more to create a capacity for more demand because it's not even needed. So why take the risk? So just some things to consider, okay? And of course, there's so much more you can cover, but I'm just giving you a brief overview. So that interview alone should take, like I mentioned, about 30 to 60 minutes, depending on the person's situation, how long they've been in back pain, if they've had multiple back pain episodes, et cetera. But the interview is not enough, okay? The next step is you want to have some kind of mechanical assessment done on your body. And a mechanical assessment is basically something, once again, I got through Dr. Stuart Mcgill. And that's basically like a pain provocation assessment where you don't replicate the pain fully, especially if the person is in a lot of pain already, but you just kind of hint at it so you know this person's limitations. Like, are they torsion intolerant, meaning if they twist their spine while keeping their hips locked, does that cause pain? Are they compression intolerant, meaning like if they load their back? Adrian, good to see you. Lisa, good to see you guys. I saw a few people popped in. If they load their back, is that causing pain? So there might be compression intolerant, okay? Or maybe they're traction intolerant. Maybe if they hang upside down or do a park bench decompression, et cetera, that actually causes them pain. And there are many tests you can use for this. Some of them are, like I mentioned, the torsion test, slump test is very popular to see if they're flexion intolerant on the left side or right side or both sides in general. There's the leg raise that you can do an SI joint test as well to determine if there's something going on with the SI joint that's contributing to the low back. Same thing with the piriformis. You can press down on that muscle very hard. And for some people, that actually exaggerates their back pain as well. So for example, if you didn't do that test and you prescribe them like a lunge or something like that, or like a Bulgarian split squat, that might actually contribute to their pain and keep them in that cycle of pain. Then you'd also want to test, are they getting those radiating symptoms down the front of the leg or down the back of the leg? So at the back of the leg, it might be more indicative of, some kind of damage going on in the L4 and L5. But at the front of the leg, it could be something from the L2 or L3 possibly, okay? And that would change your course of therapy dramatically depending on what the assessments show here. And most of the time, people have multiple things going on as well. So you have to take that in consideration, which kind of complicates the therapy like a little bit more, et cetera, et cetera. So with the mechanical assessment, you're looking probably at another, 30 to 40 minutes, okay? So just right there, you have, your 30 to 60 minute interview, you have a 30 to 40 minute mechanical assessment. You're already at like basically an hour and a half, almost pushing 2 hours. And that's just what needs to be done. And unfortunately, you're probably not gonna get that from a lot of chiropractors or PTs, and especially MDs with a 10-minute assessment. Et cetera, but that is what needs to be done to come to a complete resolution. And it's oftentimes not these practitioners' fault. Sometimes they are incompetent, but unfortunately, because of the insurance system, and because sometimes they just don't want to work outside of that insurance system, they're just not able to give you these thorough assessments. But from my experience, this is actually what needs to be done to find a proper program for a person to come to a complete resolution of their back pain, instead of they might get a little bit better and then they re-injure it a few months later, et cetera, okay? There's so much to cover here. I'm kind of briefly covering it just to at least give you an understanding of what kind of service needs to be done to actually see a complete resolution of your back pain, okay? And this is just what needs to be done. It takes time, but it's thorough. I feel it is what the patient needs, okay? Especially when they're in pain. So, okay, on top of all that, I would also recommend getting a postural assessment. Posture is extremely important, and because posture initiates all movement. So posture acts as the foundation to all movement. So if you have poor posture, you'll have all movement that you try to build upon that poor posture, ineffective movement. It might take a lot more energy for you to do something, or biological capacity to do something from poor posture versus good and aligned posture, okay? This is also important, and you can combine this with the mechanical pain provocation assessment and the interview to determine if there is something in their posture that's actually bumping them or leading them into pain. So, for example, let's say a person has, the very common one is a posterior lateral disc bulge to the L5 or maybe L4, okay? And let's say the person also has, through a posture assessment, what's referred to, let's just say, an upper cross syndrome. So it's your very, very typical, you have the hunching of the shoulders, forward protruding of the head, and he also has, let's just say, a flat lower back through the assessment. Okay, so why does this matter? So this matters first and foremost because the spine isn't in its neutral, natural alignment, okay? So that's always gonna be very taxing for the body and exert way more energy than that needs to be exerted to accomplish very basic movements. On top of that, why it's important, let's say during the mechanical assessment, we determine that the person is flexion intolerant, okay? So when they flex, it creates pain. And more dramatically, when he flexes, let's just say through a slouch test on a chair, not only does it create pain, but it creates radiating symptoms down the person's butt and the back of their leg. Okay, so then we look at their posture. All right, well, the person has rounded shoulders, the person has a forward protruding head, and has a flat lower back, which are all the things that make it more likely for him to go into flexion under load, in particular under the load of his body just through daily movement, but also if the person is still working out under external load, which will increase the amount of demand on that back, okay? And that all plays into what's contributing to their pain. And if all these things aren't dealt with in a systemic and kind of a well-organized manner, the person will most likely remain in pain, which most always does happen, okay? So in this case, you would need to, realign and establish some more lower doses in that person's lower back, some more, as you can see in people's back, some more curvature, where now the person's back is very flat, which makes it less likely for him to be able to bear a load on the back, because the natural curves of the spine create kind of like a shock absorption for anything you put on your back, for example. But also, because it's so flat, it's likely to go into flexion very quickly, okay? And we mentioned that because of the mechanical assessment, he was flexion intolerant, meaning being in a flexed position caused him pain. So what do you think would happen if this person continued to do deadlifts off the ground, for example, or even back squats, okay? Even back squats, and gets just a little bit of flexion there because he wasn't super sharp with his technique, boom, instantly under flexion. But if they had this much curvature because he had a natural lower dosis in his back, you can see there's a lot more movement that needs to happen before he goes into flexion. Where flat back, boom, right into flexion. It's not the best example, but some lower dosis in the lower back, you can see way more movement needs to happen before they go into flexion. And also, if you just have a good natural curvature in the back, there won't be so much compression and tension on the quadratus lumborum, which is a big muscle in that posterior chain. So posture, okay, super important. Posture is very, very important. So once again, we have the interview, we have the pain provocation mechanical assessment, we have a postural assessment, and then another important thing is also like a movement screen. In this movement screen, it's very basic movements. It's like, can the person do a lunge correctly? When a person squats, for example, are they able to hip hinge? Do they even know how to hip hinge? Or typically they kind of squat like this with their toes, or with their heels rather, lifting off of the ground, okay? So you see this, I don't know if you guys can see it on the screen, but you see this, you know? This is how people squat usually. But the better, more spine-sparing way would be to kind of create that hip hinge and have that neutral spine, okay? Et cetera, et cetera. During the interview process, even observing the person, like a lot of times I do interviews via Zoom, and the person complains about having back pain when they're flexed. And during the entire interview, I'm observing how they're moving without even telling them. I'm observing how they're moving, how they're sitting. And I can see they're sitting like this due to while talking to me. And at the same time, they're complaining about having low back pain while in a flexed position. So these are all cues and very important information that you need to gather to be able to give this person appropriate advice on how to avoid their pain long enough to desensitize whatever damaged tissue they may have in their lower back, okay? These little cues, these little information are all so important to focus on, okay? So movement screen, so now we covered the interview, we have a mechanical assessment, we have a postural assessment, okay? We have a movement screen as well. And the movement screen kind of goes hand in hand with the interview as well, because you know, okay, so the grocery store guy, we know what kind of movements we need to work on to help optimize his pain-free movement, and then we'll determine through the movement screen on, you know, what exactly of the details need to be worked on. Okay, so let's see what else we got. We got topic 4, education, how to move more inside, outside the gym. Okay. So yeah, now we have, you know, a lot of information gathered. Now it's time to put together an actual program for this person. So the program depends on where is this person currently in their back recovery program. Are they currently in pain? What degree of pain? Is it really intense? Is it very mild? Is it almost non-existent, more kind of like annoying? Is it on and off? So do they have pain on a few days and no pain at all in a few days? That's probably the best scenario, because just right there, they're already giving you a tremendous amount of answers of how to stay pain-free for that specific person, okay? Because they're like, well, I have pain on Monday, Tuesday, but I don't have pain on Wednesday, Thursday, Friday, Saturday, and then I have pain on Sunday. Okay, let's figure out, you know, what you're doing on Monday and Tuesday to either change those activities to be more adaptive to current capacity of that damaged tissue. And more importantly, let's figure out what you're doing on for example, Wednesday, Thursday, Friday, and Saturday to actually stay pain-free, and just replicate that for Sunday, Monday, and Tuesday, right? So I'm just making this up, but let's say on Monday and Tuesday, this grocery store employee got a bunch of boxes in and was lifting a bunch of boxes from the ground, for example. And he had to do this a couple hundred times and stack them at the grocery store. Okay, cool. Then you want to interview this person in a little bit more detail, like, okay, does the pain happen right away? Or is it at the end of the day? Or is it in the middle of the day? Or is it just all day? And this will help us establish. So let's say he said, no, in the beginning it's completely fine, but then towards the end of the day it begins to cause issues. So that instantly tells the practitioner some very important information. First and foremost, this person has room to actually be pain-free, but he is surpassing that biological tipping point of that working capacity of that tissue towards the end of the day. So let's say the first 5 hours he's okay, but then hour 6 it starts hurting. Okay, so let's figure out a way, possibly, how to reduce the demands on that back so you can finish your 8-hour shift. So maybe instead of picking the boxes up from the ground, as you're taking them from the truck, for example, let's leave them on a countertop. So you're picking them up from the countertop. And the very few items that you have to pick up from the ground, maybe you can get the assistance of an employee to help you with that. That way it decreases the load. Or maybe we could just learn how to do proper bracing, getting those shoulders back and down, contracting those lats to allow the stability of those hips, getting that core bracing enough, not too much, to allow stiffening of the core and stability of the spine. And then learning how to use those hips, hip hinge instead of squatting straight down and lifting with your back or a naked spine, et cetera, et cetera. There's so much more that could go into this, but I'm just giving you some tips of how to look at the problem. And then let's say, okay, on Wednesday you had no pain. On Wednesday, Thursday, Friday, Saturday you had no pain. Okay, cool. So what did you do during that time? All right, you didn't lift any boxes. Okay, cool. So the pain provocation, the pain triggers right now for you, there are most likely a myriad of them because probably the person's moving incorrectly in a myriad of other ways. But currently, just to simplify the conversation, the pain provocation for you right now is lifting that box lifting those many boxes on Monday and Tuesday at work. So we have to learn how to work around that, or possibly get you to take, enough time off to desensitize the area and allow the natural healing process to take place. Then you can return back in a more, in a smarter way and do the work for longer periods of time. So all of these are super important, okay? All of these, it's all in the details. And if you miss the details, you won't be able to come up with a good recovery program for this individual, and they'll always remain in pain. And I promise you, just going to the chiropractor to get a chiropractic adjustment will not work and will not keep you out of pain. And it's that simple, because it can't be that simple, because if it was, why are there so many people struggling with back issues? Okay, if all they needed to do was just go to the chiropractor and get a quick adjustment. That's just not how it works. And I wish it was that simple. That would be super cool, but it's just not. And you have to, okay, so let's use that as an example. Let's say a person's like, oh, I got back pain. The average person that knows nothing about back pathologies instantly correlates back pain with having a chiropractor be able to fix it, because kind of a chiropractor specializes in the back. And some of them are great, but a lot of them, unfortunately, just aren't. They don't do thorough assessments. They just kind of, I forgot the saying that goes in that industry, but just basically pop your back and then kind of send you on your way. But how does an adjustment teach you proper spine sparing movements so that back pain doesn't reoccur? Does that adjustment teach you how to lift weights properly in the gym to not aggravate that damaged tissue? Does that adjustment teach you how to sit properly at work, or how to distribute loads in your workstation? So kind of maybe go from a seated to standing position, then for intermittent walks in between work. Does it teach you about core bracing? Does it teach you that maybe being 30 pounds overweight is leading to compressive and shear penalties on your back and keeping you in back pain? It doesn't teach you all those things. And it doesn't teach you a myriad of other things that you need to actually stay pain-free. That's just how it is. I'm sorry. Yeah, lifting technique. Okay, best exercises. Okay, then in the educational program, when we're educating the person, obviously we want to educate the person on their pain triggers. Oftentimes people just, they live in their pain triggers and they wonder why they continue to be in back pain. So let's use this person that's flexion intolerant. So what that means is if the person flexes, they have pain, okay? Now, what you'll see with these people, oftentimes they're like, oh, I'm flexion intolerant. And what do you see? They're on their phone like this. Oh, does that cause you pain? Yeah. Oh, why are you standing in that position then all day? Oh, well, what if we stand up and just kind of bring the phone up a little bit? Is that painful? No, there's no pain. Oh, so why don't you stand that way? Oh, I didn't think of that. And my doctor never told me that either, et cetera, et cetera. I mean, that's just one small, minuscule example. There's so much more that could be covered, et cetera, et cetera. So, but just giving you like an idea, the person needs that education. And it often takes a few sessions of kind of cueing and practicing all these movement patterns outside and inside of the gym for that information to become instinctual, because that's what it needs to be too. Just to happen naturally all the time, just so you can reduce those stresses on the spine throughout the day. Quit, as Mcgill would say, picking the scab, and that way the tissue has time to heal. Because imagine if you had a huge scar on your arm and you just kept picking it all day, every day. That scar will never heal. And it's the same exact thing with back injuries. If you have a back injury and you keep picking it day after day after day, it's just not going to gristle over. It's not going to heal. And the healing, and remember also, one big misconception is a lot of people, they get out of pain. They don't have back pain anymore, and they correlate this with being fully healed. It's not the case. Usually, like for example, with a damaged disc or a ruptured disc, or disc bulge, disc herniation, protrusion, whatever you want to call it, it could take up to 8 to 10 years to fully heal. Yes, you heard that right, 8 to 10 years to fully gristle over and heal. That's presuming, and this is a very important presumption, the person doesn't re-injure that tissue. And that's the key, and that's where all of these assessments, where all this information comes in helpful, because what needs to happen is we need to educate the person on how to stop hurting themselves, because that is what's happening in the bulk majority of cases. Not in every case. There are extreme situations, such as a really bad car accident, for example. But in the bulk majority of cases, just people are doing this to themselves. And that's great, because they could actually stop doing this to themselves with the proper education and the proper coaching, which takes a thorough assessment process. And that's key. The back pain industry has to get away from these 5 to 10 minute assessments. They're just no good for the patient. They don't get much out of it. And it really hurts me to see people get that kind of service. Okay. So boom, boom. Yeah, and then another important thing to teach the person is, their biological tipping point. So your tissue could only handle like this much currently. So this is your work capacity, okay? Let's stay below that work capacity, so that way the tissue can heal. And then over time, as the tissue heals and you build more resilience through a proper reintegration program, you could increase that capacity. So instead of doing, for example, 10 sets of workout, now you can do 15 sets of workout pain-free, plus go hiking on the weekend and still stay pain-free. But the healing process needs to happen, okay? And for the healing process needs to happen, all of that stuff we talked about needs to occur. And that's just more of the physical, mechanical portion. There's, of course, the body is a system of systems, which we'll address actually right now, topic 5. So yeah, I mean, all this stuff is great, and this will already put you, just by focusing on your therapy program in this direction, it'll already put you so far ahead of what kind of approach people are taking in their back pain journey. currently, which is mostly just going to the chiropractor to get an adjustment or getting a massage or doing this and that. And there is no extensive education program on how to actually, what is causing this person's pain and how to avoid that pain through proper cueing and consistent practice. So 3-hour assessment here minimum, like we talked about. And then there are a couple of hour sessions that a person needs to come in so you can teach them how to move pain-free throughout the day, what their pain triggers are, how to identify them, how to work around them if need be, and still maintain their job or like a quality life or their workouts or whatever to allow the natural healing process to occur. And then that's not even counting the reintegration process, which takes quite a bit more time and is a bit more hands-on and varies from person to person tremendously. So it all depends, okay? So everyone, even two of the same exact people, let's say they have a posterior lateral disc bulge to the left side of the L5 disc, both of them may have completely different programs, although their injury mechanism is exactly the same, especially with the reintegration phase. Let's say we have the office worker that has a posterior lateral disc bulge to the L5, left side of the L5 disc, and we have a football player that has a posterior lateral disc bulge to the left side of the L5 disc. Their programs will be polar opposites, okay? Even in the desensitization phase of getting that tissue to heal, and then especially in the reintegration phase, it's going to be completely opposite, although their mechanism is the same. And especially if you take a belief system of what lead to that injury, that's going to go through the completely different there, okay? So hierarchy of needs. Okay, cool. So yeah, like I mentioned, it's also, this is the mechanical part, which is great, but you have to remember that the human body is made out of more than just like muscle, bone, and blood and tissue, basically, okay? The human body is a system of systems. It has many things that need to be functioning properly to allow the healing process to occur and to allow a person to stay resilient and healthy and pain-free for the rest of their life, okay? So there's a hierarchy of needs, you know, like if your breathing is off, then that's gonna basically create a cascade of negative effects on every single one of your biological systems, okay? If your digestive system is off, okay, it's gonna create a negative effect, your visceral tissue, your liver, your kidneys, whatever, are not functioning properly. It's gonna that's gonna make the healing process very difficult for you, or a lot more difficult. And more important, it's going to make it more likely for you to get injured in the future, okay? Especially if you take into consideration visceral somatic reflex. So if a person's overweight, like, hey, you know, if you're 40 pounds overweight, well, you got to lose those 40 pounds. That's going to decrease the compressive penalties on your back. That's going to decrease the shear penalties on your back. So if you do make wrong movements, it's not going to cost you so much being 40 pounds less, being at 200 versus 240, for example, okay? Because the heavier you are, the more pristine your movements have to be, because just the more stress there is on the spine altogether, okay? So you're gonna need to lose that weight. That's how it is, okay? If your sleeping sucks, well, your body repairs itself physically from 10 p.m. to 2 a.m., okay? If those hours suck for you, well, that tissue isn't gonna get the repair time it needs to properly heal. That's going to hinder your progress. Your nutrition sucks, which is also leading you to be overweight. That's going to hinder your process. If your body's not getting the proper nutrients, how is it going to heal damaged tissue? It needs those nutrients for health and well-being. Hydration, are you well hydrated? You could even go even deeper. You know, do you have some kind of like love-hate relationship in your life, like married to a person you don't want to be married to, or working with shitty coworkers or a boss that's causing insidious stress in your body, that's causing cortisol production, poor sleep, hormonal disruption, etc., etc. Is there a story gap? Do you hate your job? That's going to be causing a lot of stress as well. Do you have like other stressors in life? And it all adds up, okay? It all adds up. And if all these things aren't addressed, it's just less likely for you to actually have a complete resolution of your back pain. You might have episodes of where it's like better, but it'll always come back, it'll always get worse over years, etc., etc. So all of these things are important. So once again, it goes back to how are just getting an adjustment at the chiropractor helping with all this. Like where does it fit into this equation, you know? So especially, you know, even going to a medical doctor's office and they gave you painkillers. Okay, cool, you gave me painkillers, but does that help me identify all my pain triggers? Does that teach me good spine sparing movements? Does that fix my posture, which is leading me into a higher propensity of having moving into those pain triggers? You know, does that make me 30 or 40 pounds less overweight? Okay, to decrease those compressive penalties. It doesn't do any of that. And so because it doesn't do any of that, you can't expect an actual resolution of your pain. Now, there's a time and place for everything, don't get me wrong, but you get what I am hinting at here. In order to have a complete resolution, you have to educate the person on how to stop harming themselves, because a large percentage of the time, it is the person that is causing their own back pain unknowingly oftentimes, okay? It's not like some of them, unfortunately, like the very hardcore gym meatheads knowingly do it, but a lot of people, they just do it unknowingly, okay? Because they just don't know anything about this, which is okay because they have other responsibilities and other jobs. But even no matter what else they're doing, as I say, health, like mental and physical health, always has to be a high priority for you. In fact, it has to be number one all the time, because if it's not, you know, how are you gonna be a computer programmer with chronic low back pain? How are you gonna be that grocery store worker with chronic low back pain? You're not, okay? Or even if you are, it's just kind of like a very miserable, unpleasant existence, okay? So it lowers the quality of your life tremendously. So, topic 6 reiterates kind of what we've gone over here. Self-education. The practitioner needs to educate the client thoroughly on their pain mechanism, very thoroughly on how to have good spine hygiene, where their biological tipping point is, how to be realistic about the healing process, because especially with damaged discs, it could take up to 10 years to fully gristle over, okay? That's just how it is. And unfortunately, that's just how it is. You could be out of pain fairly quickly in most cases, but to be fairly healed, to allow a lot of work capacity for that damaged tissue takes a very long time. So it's important for a person to be realistic with that and not expect a complete resolution of their back pain symptoms in a few days to a few weeks to a few months. It almost never happens that quickly. Almost never happens. And most of the time, even when a person's therapy is great, is successful, they still have to maintain that back over the many decades they have left of their life. That's why this education process, which is dependent on a proper assessment, becomes so important, okay? Pivotal to success. And without it, you're literally just relying on dumb luck, and you can't expect to have good results there. If it is, some kind of result happens, it's just because of luck, but because we don't know what actually caused it, the chances of it, the problem reoccurring is very, very high. So, self-education is important. At the end of the day, I would highly recommend just hiring a mentor, hiring someone that's very knowledgeable in this area and that has devoted a lot of time to it, and has also preferably had a back injury, in my opinion, themselves, and has overcome it and still works out at a high level, puts a lot of demand on their body, and still pain-free. Academics is important, but as Paul Chek would say, you know, knowledge isn't power, applied knowledge is power. I've run into a few academics that are actually, they sound very smart when you're talking to them about back pathologies, because they never actually put a lot of strain on their body, they don't know how to apply it or reintegrate that kind of knowledge into building resilience in a damaged back and actually still be able to maintain high capacity. So at the end of the day, you got to hire a mentor. I think that's very important. You got to find the right person for yourself, preferably someone that avoids symptom management strategies. You got to pick up books. You have to read a lot of great books. Let me see if I could find some books here. Give me one sec. Okay. Well, I don't know. I have some books here on the side. I can't find any currently, but there are a lot of great materials out there. Start with a very, very simple one is The Back Mechanic by Stuart Mcgill. That one is a good beginner book. And if you don't work out with like super high intensity, for example, it's oftentimes all you really need. If you just, for example, have an office job and just want to hang out with your kids on the weekend and be pain-free, oftentimes that's all you really need for that population most of the time. But if the damage is extensive, you might need a lot more. I think he has another book. Give me one sec. I'm going to bring him over here, actually. Let me try to find him, though. All right, I found one of them. So Ultimate Back and Performance. This is a great book as well for the athletic-minded population. This also happens to be dealing with back pain. Paul Chek has a great program, IMS-1, on fixing posture, okay, which is also very important. Where did I put the, give me one second. I don't know where. Oh, I also brought this book here. I forgot it here. I kind of lost my little paper. I don't know where I put it. But anyways, also what's important to learn, you don't need to have, you don't need to be like an anatomy master, but you should, this book is great. It's very well laid out, but you should at least have a general understanding of the anatomy of the low back and the hip structure as well. Inevitably, the whole body works as one unit. So everything always affects everything, but just starting there is already a great step. And just have like a general understanding, like here's a quick model, like have a general understanding, like there are 5 discs in the lower back, you know, like what's the purpose of the vertebral body? What's the purpose of the intervertebral disc? Just the general anatomy of the disc, you know, they have like 2 end plates, inferior and superior. And then they have an outer material called an annulus fibrosus, and an inner gel-like material, okay? They have these posterior elements as well. They have the spinal cord and all the nerve roots, et cetera, like what do they do? That way, I feel this is very important in the education process for the client, because if they do have a flare-up and they kind of feel it, their mind's eye sees inside that back a lot better and can navigate and strategize of how to stay pain-free, versus if you don't have that understanding of the anatomy, you don't have that mind's eye depiction of the low back, and I feel it is a hindrance to the therapy, okay? All right, so I hope that clears it up. Back pain is very common, so if you have it, don't feel discouraged. The majority of the time, with the proper education, the patient can stay below clinical levels of pain for their whole entire life while maintaining pretty high capacity in their workout routine. So I'm a perfect example of that. I had an injury in 2015 and have been able to maintain pretty high levels of physical activity while staying pretty pain-free for the most part, okay? Sometimes there's like a little bit of issues, like very, very small, but it's very rare compared to the injury I had. So don't be discouraged, just be very, very patient. Make sure to thoroughly educate yourself on the issue Because inevitably, no one knows you better than you, okay? So like what I did, for example, I took a myriad of courses. I took various courses through Paul Chek, his integrated movement science courses, and they do take a lot of time, okay, to learn the material and master the material, but it's just what needs to be done. I took all of Mcgill's online courses, probably read close to probably 12 to 15 books on back pathologies or anatomy of the lower back, and also reached out to a lot of mentors, okay? That helped me along the way. I definitely didn't do it myself. So that's just what needs to be done. Is everyone gonna do it? No, but maybe that's why the majority of people with back trouble stay with back pain. And unfortunately, a lot of people do, in my opinion, resort to surgery as a quick fix, but it's not gonna work the majority of the time unless that education is still there. Because if the person was never educated on what led to their pain after the surgery, they're very, very likely to participate in those behaviors, those movement patterns, to facilitate that belief system that led them into that cycle of pain to begin with. So it always comes back to, you have to educate yourself. And it starts with a really good assessment, and then you can go from there. Okay, so I hope this helps. It was great to see you guys, like always, and have a good weekend, okay? All right, guys, take care.